Hello dear students. Hi, good evening. How are you? Am I audible to you? Good evening, Captain Krishna. Good evening, Sneha. Am I audible to you? Yes, thank you very much for joining at such short notice. Now, this is your red hot analysis for the NEET PG 2022. Before we start the questions, how was the exam, people? I have heard the question paper was approximately moderate. It was not a very tough question paper, they said. It was mild to moderate in severity. I heard this is the exam fever is over, but still we are discussing this so that it can be for the help in case of future and to know what exactly is happening. Okay, so yes, good evening Sneha, Ajay Yadav, Pradeepa, Ajit Kumar, Swati, Kriti Gupta, Vikram Balaji. Yes, moderate, right? So if you think of the exam as fever, so what is your verdict? Your verdict is moderate. So can we all agree to settle upon this? Can we all agree to this? What do you think? The exam was a moderate exam? Yes, so everybody has agreed to the concept that it is a moderate exam. So excellent. Let me tell you one thing. This time you are going to actually have a barrage of advertisements happening everywhere. The condition is that everybody will speak about the notes capable of, not just any person, everybody will be speaking about the notes coming into play, because this was a very regular question paper, because very regular questions were asked. Any faculty can actually say that the question paper has come from his notes. Is it right? So before we start the session, let me tell you a few things. I'm Dr. Meenakshi Sundaram here, and I've been teaching MBBS MD students and DMMCH students for the last 11 years. We have joined the digital age in the last 2 years, and I've been at the Unacademy for the last 2 years. And this is a plus subscription. You can get a plus subscription at Dr. ASM Live, and you can attend all my classes. You can also take an iconic subscription. These are the special class features. Now, apart from this, let me do this later. Let's begin with the first picture. Tell me, what was the picture that you saw here? This is what picture? I'm pretty sure they didn't give you this picture, but what was this? When I show you this picture, what comes to your mind? I'm not sure whether you got this picture in the exam or not, but what is this a picture of? Anybody? This is an inclusion body. So now tell me, what is this a picture of? No, I'm saying this is an inclusion body. We are actually targeting another question. This is inclusion body. What inclusion body is this? Come on, people. Yes, excellent. It is Taurus body. Remember, you have learnt about Taurus body many times in the virology classes, because remember, virology is meant for the inclusion bodies. If at all you speak about inclusion bodies in bacteriology, you can have them in case of chlamydia, and rarely you can actually have them in case of rickettsia. There is only one rickettsial group of organism capable of giving an inclusion body, which would be called as morula. Yes, all these questions will help you in the FMG June exam. So Taurus bodies, it thinks about only one kind of virus, which is yellow fever virus. So you all agree to the fact that you actually had Taurus body in the question paper. What were the theoretical questions they had asked? They had spoken, was there a history of travel? Was there a history of travel? Was there a history of travel, students? Yes. So remember, they are trying to target you. They are trying to make you think about a person is moving from an endemic area to a non-endemic area. You're moving from either a non-endemic area to an endemic area. Remember, if somebody has to travel into India, they should be able to have yellow fever vaccination. But Indians don't generally have to go for yellow fever vaccination if they're going to travel anywhere. Why? Because India is not endemic for yellow fever. So that brings us to the question, what is this Taurus body? It's an intranuclear inclusion body of the host protein seen in liver cells infected with yellow fever virus. And what is the strain here? Come on, all of you. It is the 17D strain of vaccine. So what was the question? A patient had a travel history, and in that particular patient you are able to see the Taurus body, and if the Taurus body is seen, you think about the virus and tell us what inclusion bodies are there. They are asked about 17D virus, and this 17D strain is meant for yellow fever. This vaccine protects against yellow fever, and it's a viral fever infection affecting the Africa and South America. Remember the Suez Canal, that is where it became very famous, the yellow fever virus, and this is actually given. Most people begin to develop immunity within 10 days of vaccination. Remember this part? What are the important things? Most people begin to develop immunity within 10 days of vaccination, and 99% are protected within 1 month. In just 1 month, 99% people can be protected, and this vaccine is supposed to have a lifelong activity. And this vaccine can be given for controlling outbreaks of disease, and it is given by intramuscular or intradermal injection. Now look at this part. What about the 1331 Danish substrain? This is meant for BCG vaccine. And what are the other options given? Nakayama strain was given. Nakayama and Beijing strain, both of them are meant for Japanese encephalitis vaccine. So yes, they said vaccines were given in the option. Is it right, people? Vaccines were given in the option, they said. Is it right? Yes. So for this question, remember the answer is very simple. If you had Taurus body, the first one you should think of would be the yellow fever. And if it is yellow fever, 17D or Dakar, the two vaccines can be spoken of. And if you come for Danish 1331, it is meant for BCG. And if it is Nakayama, it is meant for Japanese encephalitis. And remember, in Japanese encephalitis, there is no hemorrhagic streak. This is not meant for hemorrhage, it's meant for encephalitis. Yes, Nakayama vaccines were given, no problem. So now let's go for the next question. Now this was there. Can you tell me what is this a picture of? This was there. What is this a picture of? Yes? Yes, excellent. So there was a question based on this, right? What was that? Dr. Sonali Mehta, I'm not able to understand. What is the Weigels component? Yes. Now look at this part here. This is a place where you're able to see two nuclei at the tail. We had repeatedly told students to focus on this picture because this is a very easy area for asking questions. Why? Because since 2017, there was a very lazy process of making questions in terms of Wuchereria bancrofti, because we have started teaching people Bancrofti, FTI speaks about free tip tail. It means no nuclei in case of Wuchereria bancrofti tail tip. I have repeated this in many exams, in many discussions. So remember, when we discussed about Wuchereria bancrofti, we had told them in case of Brugia malayi, the tail tip will carry two nuclei. So here you're able to see two nuclei. This is a case of Brugia malayi. We don't have to worry about Timori right now. This is Brugia malayi. In case you want to see how Wuchereria bancrofti will look, this is how. So you can notice there is a faintly staining sheath. The sheath is very faintly staining, and the nuclei are not going till the tip. Let me erase this part. The nuclei are not going till the tip of the area. So no nuclei in the tail tip is a property of Wuchereria bancrofti. And remember what kind of questions they have asked. You have divided the filariasis into two types. One is Bancroftian filariasis. Bancroftian filariasis occupies 95% of cases everywhere in the world. So remaining 5% cases are followed by the Brugian filariasis. Brugia will be of two types. The one that is Malayi in the Malaysian Peninsula area, and then the other one is called as Timori in the Timori Islands. These are the most important questions raised and asked many number of times. So no nuclei at the tip is Wuchereria bancrofti. Two nuclei at the tip will be Brugia malayi. Done. Now what are the other things that they can actually ask you in the upcoming exam? Yes, Eosinophilia avestine. Definitely remember, if it is Brugia or Wuchereria, whatever it is, if it is a parasite, you can expect the eosinophils to elevate. When eosinophils are elevated, the mast cells are activated and you will be having IgE antibodies elevated. All these are case discussions similar to that of allergic reaction, but they are not hypersensitive reaction, they are parasitic infections. Because this is a very fast revision period, I will not be able to teach you like how I would teach you in a regular class. Please forgive me if I'm going slightly bit faster, because I'm slightly excited and I'm trying to give you the answers, because I know most of you have gotten the right answers. In case it was not there, you will be able to understand the reality, that's all. So remember, Wuchereria bancrofti is larger, 244 by 296, and this will be 177, 230. When it comes to the body nuclei, the nuclei are equal size, countable. And in case of Brugia malayi, unequal size and uncountable. When it comes to the cephalic space, the cephalic space is shorter, and in Brugia malayi, longer. The head space is larger in case of Brugia malayi. When it comes to this area, nuclei in the end of tail is a property of Brugia malayi. No nuclei in the end of the tail is a property of this particular Wuchereria bancrofti. Now, this was the exact question we discussed in the last minute revision session with MCQs and INICET recall. In INICET also there was a question similar to that. I had told you they will be asking you questions from this area. This was repeated in INICET also, yes or no? You got this copper penny bodies in INICET also, yes or no? Just a question, did you get copper penny bodies in the INICET exam, people? No? Okay, so in the INICET exam, they had asked about copper penny bodies, the picture. While you'll be able to have Sujit Reddy, I would like to tell you faster. I'm doing my best. I'm trying to make sure whether the same question is correlating, nothing else. This is not the place where I'm trying to do anything for my sake. This is only for the sake of you. I just want to correlate whether I'm getting the right questions. See, sometimes the questions may be given a different way by the students. I'm just trying to make sure these are correct. So please forgive me if I'm slightly slower in moving forward. Yes, so no diagram was given. They had mentioned copper penny bodies. Excellent. This is also referred to as copper colored sclerotic bodies. Copper colored sclerotic bodies. Now, if at all you have seen violet colored wart-like lesions, that would also speak about chromoblastomycosis. And here I had taught you in the subcutaneous mycosis chapter that if it is a subcutaneous mycosis, it generally attacks people in the rural area, and the reason being they don't wear proper footwear. Don't wear proper footwear. Just one simple question. Please tell me whether they asked you about any agricultural worker in this case history. Was there a case history in the agricultural worker? Did they mention any agricultural worker or farmer in this question? Yes. So remember, in case of mycetoma also, it will be a similar picture. How many of you thought of it as mycetoma? How many of you wrote the answer as mycetoma? Remember, if there is no footwear, you will have very small injuries which can be penetrative or it can be blunt trauma. When there is a blunt trauma, you are able to put the particular fungal spores or fungal mycelia into the skin level, the level lesser than the skin. So subcutaneously it can be deposited, because of which you can have two diseases. One, it can be either mycetoma or it can be chromoblastomycosis. How do you differentiate them? In case of chromoblastomycosis, multiple discharging sinuses are not obvious. Here, multiple discharging sinuses will be noticed. And here you'll be able to understand this mycetoma will not be carrying copper penny bodies. This one carries copper penny bodies, copper colored sclerotic bodies. Okay. Yes, one more thing, and some of you have spoken about sporothrix being asked in the option. If it is sporothrix, what should have been the case history? If sporothrix was given, then farmer should not be the answer, gardener should be the case, especially the people who are tending to the rose plants. Rose plants. Okay, there was another question for mycetoma. Yes, if they say rose gardener, think of sporotrichosis. If sporotrichosis was given, this should have been the picture, which is asteroid bodies. I had no time in preparation for this particular class. Why? Because I chose this picture, which I discussed in the just 3 days back. Asteroid bodies can be found in granulomatous conditions and foreign body granulomas. It is also found in sarcoidosis. It is found in case of sporotrichosis. Now, if there is anybody who is present here, can you tell me what was the question about mycetoma? A small request. Can you tell me the question about mycetoma? And this is the picture for sporotrichosis. They should have said the eruptions along the line of lymphatics. Some of the people said there was a question for sporotrichosis. I'm not very sure about it. But if you see the word rose gardener in the question, and they had also mentioned there is ulcero-proliferative, painful, nodular eruptions, and they say they are happening along the line of lymphatics like this, it is sporotrichosis. Drug of choice would be itraconazole. Okay. Farmer with copper coin bodies. If it's a farmer with copper coin bodies, it has to be chromoblastomycosis. And remember, if there is a mycetoma question, please let me know. I'll be happy to answer this. Okay. Yeah, Nikhil Yadav, we have already answered this question. Tell me, this question, this picture was actually given. They said the diagram was given. The diagram was given. They spoke about anogenital warts in a female. Is it true? Yes. If copper penny was asked, correct statement was asked, the answer is not sporotrichosis. Correct statement was asked, it would have been copper penny body would be chromoblastomycosis. Yes. Yes. So anogenital warts in the female was shown in the picture. If they say high risk, if they use the word high risk, then it has to be the elements. Can you tell me what were they? Yeah, easy paper tha, I understand. So 1, 2, 3, 4 are meant for causing common warts. Your 6 will be focused on. Yes. Now, if there was 16 or 18, that would have been higher risk. That would actually be contributing towards. If it is 16 or 18, contributes towards cervical cancer or anal cancer or penile cancer. What was the similar question raised in NEET 2021? There was a question asked about oropharyngeal cancer. Oropharyngeal cancer is caused by HPV 16/18. People were confused. They thought it was, people thought it was Epstein-Barr virus. Remember, Epstein-Barr virus causes nasopharyngeal carcinoma, while HPV is known for causing oropharyngeal carcinoma. How? HPV is transmitted through oral sexual act, and the answer has to be either 16 or 18. Who was present in the option? Okay, 16 was not there. The option is 18. Okay, and 6 and 11 will be low risk. Tell me, low risk will cause what? Low risk will cause what? Low risk is known for causing what? When you speak about 1, 2, 3, 4, they're not even taken as risk. They are known for causing common warts, which is referred to as verruca vulgaris. Verruca vulgaris, common warts, 1, 2, 3, 4. If it is 6 and 11, it would be low risk. And low risk is known for causing only the anogenital warts in the females or males. Just warts. Anogenital warts in the genitalia. Warts is 6 and 11. High risk will be 16 and 18. They can cause cancer. Okay, you saw this picture. What is this? People kept on sending me this message. They said it was a cobweb protein coagulum. Protein coagulum cobweb. So if at all you saw the picture, then you can easily slide towards tuberculous meningitis. If you saw this, you can easily slide towards tuberculous meningitis. And some of the people told me it was like the diagram that I had shown you, like 1 month before that we had discussed it. If at all you saw that, it's okay. If you didn't see that also, it's okay. But we had discussed this very clearly. We spoke about pyogenic meningitis, we spoke about tubercular meningitis, and we spoke about viral meningitis. What is the gross difference between any of them? Pyogenic can eat the glucose very rapidly, so they can go for less than 10 milligrams per deciliter in case of CSF. This will be causing a condition called as hypoglycemia, and which is called as low glucose in the CSF. And in case of viral, the glucose is absolutely undisturbed, 40 milligrams per deciliter, because 40% of plasma glucose is the CSF glucose. CSF glucose in any human being should be 40%. If I take 100 milligrams per deciliter, 100 milligrams per deciliter as the standard glucose level for a human being, then he should be producing 40 milligrams per deciliter. If the glucose levels are absolutely normal, it is viral. If it was less than 10 milligrams per deciliter, very low, it is pyogenic. But this is tubercular. It is a type of atypical meningitis. It is also non-septic meningitis. It is also an intracellular type of meningitis. It is tubercular meningitis, and it can produce a characteristic cobweb coagulum. And why is the coagulum being formed? Because of the unique kind of proteins that are accumulating inside the CSF. Yes. Yes, that is what I'm trying to say, Kriti Gupta, because we had discussed in the class that you will be having very mild fall, not a very huge fall. If it is very less, I'll use a different color. If it is very less than 10 milligram, it is pyogenic. If it is absolutely normal or near normal, somewhere between 35 to 40, it is viral. If it is between 10 to 30, somewhere a mild fall, it has to be tuberculous. Why there is a mild fall? Because MTB is also a bacteria. A bacteria also goes for glycolysis, but it won't go for glycolysis like the pyogenic meningitis. What is the reason? In pyogenic meningitis, we have typical bacteria. Typical bacteria can multiply rapid fast, but MTB will not multiply rapid fast like other kind of bacteria. You know, M. leprae can actually have an incubation period for years. MTB can have incubation period between months and weeks. MTB does not multiply so fast, so it takes at least 3 weeks for growth. So when they're not growing so fast, they won't be able to utilize the glucose so fast. So the glucose utilization is slightly lesser compared to other pyogenic bacteria. But in case of viral meningitis, viruses don't have the property of glycolysis, so they will not go for metabolism. So what happens in viruses? Remember, viruses are referred to as energy parasites. If they are energy parasites, they will attach themselves to the host mitochondrial membrane, and from the host mitochondria they will take up the ATP, and then they'll utilize the ATP and throw back the ADP. So they do not have to carry the ATP, they do not have to synthesize the ATP. Yes. Next question. This was, I just got you the picture. They said it is a soldier's question. A soldier's question. What else? Can you tell me? Oh my God, Lavanya Yalavarthi. Are you sure in this question they gave you a gram-negative history? Was there a gram-negative history? Are you sure? Please tell me. Others, please concur. Please tell me. Yes, Hitesh Chitluri, I'm really appreciating the speed that you want to go forward. I just want to make sure I don't leave any gaps in the discussion. This discussion, even if you see that later, you should not be able to feel that the class was not useful. That is why I'm trying your best. They gave a slide showing CSF gram stain, lot of lymphocytes. One question. Did the question paper say it was a gram stain? See, did the picture say it was a gram stain? If it is a gram stain, did you see cocci in it or bacilli in it? If it is a bacilli, you might have been confused for an AFB staining, but are you sure they gave only gram staining? We'll come back to this question later. No gram stain. Yes, excellent. So you might have assumed. I'm not very sure. I may be wrong because I'm not the person who saw the question paper with my own eyes. You have seen it. They did not mention gram stain. Yes, they had given the stain. Yes, they had given the smear. They gave some gram stain. Huh? See, okay. Okay, people, you might see there is a very good possibility you can confuse the options between two different questions, understandable. But let me put forward my statements clearly. If you're seeing cobweb coagulum in the CSF, and if the glucose is only mildly falling, then I would choose TB meningitis ahead of others. If it was a gram negative bacilli, it could have been any bacilli, and if there is a gram negative cocci, if they say it is a gram negative cocci, definitely they are pyogenic meningitis, like in case of meningococci, or even you will maybe having Neisseria gonococcus also can cause. If it is there, glucose will be massively falling if it is a typical bacteria. When you say gram positive cocci or bacilli causing meningitis, apart from rickettsia and chlamydia, I repeat, gram negative cocci and bacilli apart from rickettsia and chlamydia, if they cause meningitis, then they should be pyogenic. And the moment it turns pyogenic, glucose is drastically falling. Here it is only mildly falling. That's all. So let me go to the next question. Did they say soldier for this question, people? Manoj Pradyot, may I know what exactly was not clear? Manoj Pradyot, may I know what was not clear? No picture. Oh, yes, yes. In this, there was no picture. Only I added this picture because this is a classical case of epidemic typhus, and one of the rickettsial classes. There was a question based on, there was a session based on Harrison's rickettsia I did. In that I had told you the case. I had told you a person is sitting on a bike. The bike is a Kawasaki bike, and he is sitting on the bike, and he is wearing a helmet. The people who are wearing helmets, if they are not taking care of themselves properly, they can have dandruff on one side, or they may be having the lice infestation on the other side. And this particular person, if is actually entering into this, the lice can actually spread a particular bacteria called as Rickettsia prowazekii. Prowazekii sounds like Kawasaki, and he is sitting on the bike. On is epidemic typhus. On is epidemic typhus, and Rickettsia prowazekii is what we are looking at. Rickettsia prowazekii is what we are looking at, and louse will be the transmitting agent. Yes, louse transmission was given. When I told you the case discussion, we spoke about a biker. Bikers who are riding Kawasaki bike, that is just for mnemonic sake, Kawasaki bike. Kawasaki sounds like prowazekii, and he will be having rashes everywhere on the body. And I told you there is something called as sparing of palms and soles. And I told you the bikers will be wearing proper gloves and shoes, because of which the rashes can happen anywhere except in the palms and soles. So in this question, was there a statement of sparing of palms and soles? In this question, was there a statement of sparing of palms and soles? Excellent. So this was exactly like how I had told you in the story. See, I did not make the organism's infection then gave the story. I just gave the story based on the organism. So the question paper definitely does not belong to me. The question paper belongs to all of us. It belongs to all of you. In that discussion, I had told you this. So just a simple request, if at all you have any time, if you're going to prepare again for the exams, or if it was your first exam, please go through some of the lectures on Harrison-based infections. It will be helpful for you. And there was one question on a pregnant lady, and tell me what happened to the pregnant lady. Okay, so they had said pregnant lady had white discharge, and they collected the white discharge and they went for a culture. And in that culture, what did they see? Okay, they saw budding yeast. Fine. If they're seeing budding yeast, what can be the culture media they're saying? They have given an option as SDA, Sabaros dextrose agar. Some people have been asking me about chrome agar. Chrome agar is not at all related to fungi at this point of time. These are the components of chrome agar. Please take this down because they may frame a question from this again. It contains peptone, sodium chloride, sodium deoxycholate, chromogenic mix, 10.5 propylene glycol, 15 grams per liter of the agar. All these things will be called as chrome agar. This is for differentiating coliform bacilli. These are for differentiating coliform bacilli. You can speak about the presence of E. coli. It can also speak about Salmonella and Shigella, etc. These are for bacteriology. Okay, these are for bacteriology. Now, is there anything else that they asked you? Yes. So, have I answered your question? Pregnant lady, white discharge, budding yeast. If budding yeasts are to be seen, we can go for SDA because we can try to grow, we can try to show Candida. But if they asked you if you want to grow Candida on the laboratory medium, if there is a human serum growing, if they had given you the option of human serum at 37 degrees Celsius, then you'll be seeing germ tube formation, and that germ tube formation is called as Reynolds broad phenomenon. If you try to grow the organism on corn meal agar at 25 degrees Celsius, you'll be able to see chlamydospores. Was any of these given? Was any of these seeds given? I'm sorry, I'm not able to understand what is. Can you tell me the question about the bird seed agar? Let me see, I do not know what the question means, but let me tell you just these things. Bird seed agar is done in case of Cryptococcus. Okay, and this is a selective medium. It is a selective and differential isolation medium. Differential isolation medium for Cryptococcus. For Cryptococcus. And what are the if you want to know the composition of birdseed agar, let me tell you, it contains Niger seed, it contains glucose, it also contains potassium hydrogen phosphate, it contains creatinine along with that of the agar. So let me tell you, birdseed agar contains Niger seed, and it will also be containing additives can be added as penicillin. The principles can be taught to us later. But what is the interpretation? Remember, the interpretation of birdseed agar is, if you have positive result, the colony will be showing development of brown black. If you have brown or black pigmented smooth colonies, pigmented smooth colonies in case of birdseed agar, you take it as Cryptococcus neoformans. And if it is negative, what can you see? You'll be seeing non-pigmented colonies. If it is non-pigmented colonies on birdseed agar, then what is the understanding you have? You'll be able to see it is Cryptococcus lawrenceae, or it can be Cryptococcus or Saccharomyces cerevisiae. Saccharomyces cerevisiae. I'll write this again. If it is a negative answer, it will be Saccharomyces cerevisiae or Cryptococcus lawrenceae. There is no pigmentation in the colonies. If it is positive, it is brown-black pigmented colonies. I had told you 2 weeks back where I was speaking about Cryptococcus neoformans. It is inositol assimilator. It is also urease positive. I also told you it is phenol oxidase positive. Phenol oxidase positive can produce pigments. And if it was the case that they have asked you, then this is the answer. Now, No, I'm just saying, I'm giving you all possible reasons. See, if you have in the upcoming INACT exam for the November session, if they ask you about chrome agar, remember chrome agar is for differentiating the coliform bacteria. In case of birdseed agar, it is meant for Cryptococcus neoformans only. Okay, neoformans only. Okay, somebody has spoken about pneumonia, right? What is that? Truck driver pneumonia. What is that the question? Truck driver had pneumonia. Anything else in the question, people? Yes, melanin pigment is seen. It has to be Cryptococcus neoformans. Can you please help Lavanya Yalavarthi and help me please? What is the question about truck driver? Can you just put me bullet points and words? Truck driver, pneumonia, what else? Yes? See, if you're speaking about the truck driver, pneumonia, and if it is aspergillus, you can go for Sabrots dextrose agar, and you will be able to have malt extract also, and you can also go for less commonly used brain heart infusion. Brain heart infusion medium. I'm just telling you, if you're trying to culture them, you can go for SDA, malt extract, or brain heart infusion. If it's fungal culture. Anything else? Okay, paracrine signaling, endocrine signaling, autocrine signaling, chemical messengers were shown and neighboring cells were shown. Okay, lymphocytes less than 6,000. SDA is given aspergillus like given an STA. Okay. Aseptate hyphae asked drug of choice. Excellent. So what are the aseptate hyphae? Aseptate hyphae mean they are lower fungi. They are lower fungi. And who are the lower fungi? You will be having Absidia, Mucor, and Rhizopus. And if it is Mucor, initially the drug would be amphotericin B. But this organism has been showing resistance to amphotericin B very strongly. So in 2009, they introduced a drug called as posaconazole. Later in 2015, they have introduced a drug called as isavuconazole. Now, was there any of these options in the question? Okay, pulmonary sinus fistula and okay, that would become a surgery question. So don't worry about this at this point of time. Tell me, is there any other microbiology questions left? So have I answered all your questions? I'll wait for you. I'll be there for the next 5 minutes to help you. If you have any other questions, please tell me. Do you have any other questions to ask me? I will wait for you. So shall we revise the questions once again if you want? And in the clinical case history, had they given hepatomegaly and icterus? Was there a question on leptospirosis? I don't understand. Okay. So are you saying that Trichophyton was actually there? It has been Trichophyton rubrum, right? Okay. See, a simple question I'm asking you. Did you get a question on Trichophyton or penicillium? See, if it was Trichophyton rubrum, it produces wine red pigment. It produces wine red pigment. If it is Penicillium marnefi, it can produce, brick red pigment. It can produce brick red pigment. Tell me, which pigment did you have in the exam? So there was a question on Penicillium marnefi and there was a question on Trichophyton rubrum. Is that correct? Okay. So in case of Trichophyton, they are superficial fungal infections. I repeat, they are superficial fungal infections and they are capable of attacking from the soil and can be acquired from person to person. It can be acquired through fomites. They can come from the soil. They can come from humans to humans. Was there any case history given? Was there any case history at all? Tangle, you have mentioned something like female pattern alopecia. Okay, there is acute angled branching. Remember, acute angled branching, and if it is septate, think no more than aspergillus. And for aspergillus, I have told you the previous kind of statements where I told you the different kinds of culture media. It can be SDA, it can be malt extract, it can be brain heart infusion as a low level or a very simple or plain level ones. If it is aseptate hyphae and lower fungi, it can be Absidia, mucor and rhizopus. In case of mucor, you can go for amphotericin B, and if it is not working, you can go for posaconazole and isavuconazole. If they say truck driver and he is actually suffering from pneumonia because of aspergillus, you can go for the same concept. And if they say truck driver is having pneumonia because of aspergillus, understandable. Why? Because aspergillus can cause paranasal sinus polyps. Paranasal sinus polyp, and he can also have nasal polyp. It is also capable of causing, see, aspergillus is capable of causing hemoptysis. One student said there was a question about hemoptysis. Is it true? Is it true? Was hemoptysis a part of the question? Okay, when they say abundant microconidia, remember, if they say abundant microconidia, you don't have to worry about anything else, because microconidia is the differentiating point for trichophyton. Trichophyton is meant for microconidia, less amounts of macroconidia. In case of the other organisms like this, for example, if it is epidermophyton, then it would be abundant macroconidia versus smaller amounts of microconidia. In case of microsporum, it is macro and micro almost the same. So when they say abundant microconidia, please go for trichophyton more than anything else. Is that clear? One more question, recurrent rhinitis, options were mucor, rhizopus, etc. See, that is what we were discussing. If at all they speak about any kind of recurrent rhinitis or recurrent nasal blockade or recurrent paranasal sinus polyps, it has to be aspergillus. So ask yourself what kind of branching was given. If it is acute angled branching and septate organisms, they are aspergillus. If it is aseptate organism and they are lower fungi, and if it is amphotericin B, think of mucor. That's all. Have I answered your question? Okay, for 4 species of trichophyton were given. Then the answer, one question on treatment of Stamper, okay. All species of trichophyton. So was Trichophyton rubrum given in that? Was Trichophyton rubrum given in that, people? Was rubrum given? Then your answer is done. So it is Trichophyton rubrum. What about the Penicillium marnafi question? See, if at all they have spoken about a HIV patient, it can cause fatal systemic mycosis. Other than that, Penicillium marnafi is not known for causing diseases. It's an opportunistic mycosis. While Trichophyton is not opportunistic, even in people who are immunocompetent, they can suffer from Trichophyton infections. Yes, Danny Lucifer, we have discussed about the bird seed concept. The bird seed colonies is for Cryptococcus neoformans. It is brown, black pigmented colonies, Cryptococcus neoformans. No pigmentation, it can be Cryptococcus lawrencei or Saccharomyces cerevisiae. If at all the question was about Candida, it is not even chrome agar. Chrome agar is meant for differentiating between the coliform bacteria. So the answer you are looking for, if it is Candida, should be SDA. So they had given in most of the question about past history what all they wanted to know. They in simple plain one sentence, and there were 2 to 3 questions same in the topic. I don't know. Okay, so in this question, yes, any, okay. If it is pencil-shaped conidia, it can be any kind of dermatophytic organism. Tell me if it is pencil-shaped macro or microconidia. Pencil-shaped macroconidia, is it? Okay. 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 Did they give you anything about the mount? It can be dermatophytosis. Still, it can be dermatophytosis. The thing about penicillium is possibly. Okay. Okay. See, in case of penicillium, you'll be having conidiophores at the end of each branch. Conidiophores can be seen at the end of each branch by green spherical concentrated units called as conidia. So that part is understandable. But if you're saying penicillin macroconidia, it can still be a teardrop activity. It can still be a trichophyton. Macroconidia would mean. Pyloni. Oh, it's a pylonal sinus you're saying. Okay. So let's revise all the questions once again. See whether I have been on target of whatever you have told me. So first question was about a person who is having Taurus bodies in inclusion bodies. He may have hemorrhagic or non-hemorrhagic fever. He has hepatomegaly and splenomegaly. So if it is Taurus body, then what is the vaccine given for him? The vaccine given for him would be 17D Dakar or 17D or Dakar vaccine. And if it is Nakayama, the Nakayama strain is for Japanese encephalitis. Danish 1331 is for BCG. Does anybody know the other strain given? Okay, pencil macro teardrop microconidia. If it is teardrop microconidia, then you don't have to worry much about it. Okay. So if there is any other strain that they had asked you in the question paper, please ask me, please let me know. Okay. Next, you had a question about the two nuclei present at the tail tip, that is Brugia malayi. Previously, they had used to keep on repeating the questions on Wuchereria bancrofti. In Wuchereria bancrofti, no nuclei at the tail tip, FTI. And now this is the example of Brugia. So this is Wuchereria and this is Brugia malayi. So they have jumped from Wuchereria to Brugia malayi this time. So it's an easy question only. It causes lymphatic filariasis called as Brugian filariasis. These are differences. And remember, in case of Wuchereria bancrofti, you can have oviparous producing thousands of microfilaria. And there was a farmer, if the farmer is having copper penny bodies in his foot with discharging sinuses, think of chromoblastomycosis. If is a sporotrichosis case, then it could be a case like this. They'll be giving you rose garner and rose plant, multiple discharging sinuses along the line of lymphatics. And if it is mycetoma, you can have chronic indurated swelling. I repeat, if it is mycetoma, it is chronic indurated swelling with multiple discharging sinuses. And this is not a case of mycetoma because they are given you copper penny bodies. If there is copper penny bodies, think about the chromoblastomycosis only. You have to go for surgical debridement and local installation of antifungals. And this is asteroid bodies for sporotrichosis. And the next question was about the human papillomatous diseases. We had discussed this. There were multiple lesions on, that is wart-like lesions on the anogenital area. If it was 1, 2 and 3, it causes common warts. If it is 6 and 11, it causes anogenital warts, which are low risk. And if it is 16 and 18, high risk cases, which is meant for cervical cancer, anal cancer, penile cancer. And if it was HPV, it causes oropharyngeal cancer. We also discussed about EBV causing nasopharyngeal cancer. Next, we were speaking about the CSF fluid showing cobweb protein coagulum. It cannot be a gram-negative cocci. If it was gram-negative cocci given, then it becomes a pyogenic meningitis. If it is pyogenic meningitis, glucose will be dead low. It can be less than 10 milligrams per deciliter, so it can't be. This is tuberculous meningitis because glucose levels are approximately slightly lesser, between 10 to 30. If it is absolutely untouched, between 35 to 40, then it can speak about viral meningitis. Yes. Did you have Weigel strain? Weigel strain. I'm so sorry. I don't think I have heard about Weigel strain. But if you are asking me about Gerald, is it Gerald Lynn strain you're asking me? Gerald Lynn strain is for mumps. I'm sorry, I'm really sorry. I do not know about Weigel strain. Remember, you have something called as Gerald Lynn. Sorry. Gerald Lynn strain. This is meant for mumps. Does anybody know about Edmonston-Zagreb strain? Edmonston-Zagreb. Yes, excellent. Edmonston-Zagreb strain is for measles. May I know what was the question about the Gerald Lynn strain? Yes, any other question from this? Okay, let's move forward. And this was a classical case we discussed in the, if you really would like to learn more about the rickettsia, I have given you story-based understanding of all rickettsia. In that video, I had given it as Harrison's based rickettsial learning. In that I have given you the mnemonics and stories for learning, the stories for learning how rickettsia, organisms and the vectors. And I also asked questions about MCQs. You can go back and learn anytime if you are preparing again for the exams or if you're a first timer. In that I had given you a story about the biker. The only difference is here I told you about biker, in the question paper was a soldier. Everything else is the same. It's a case of rickettsia Prowazeki causing epidemic typhus, and pregnant lady having candida. If you're going for a white discharge and the chill area, then you can go for the SDA. Chrome agar is meant for coliform bacteria, and birdseed agar is meant for Cryptococcus neoformans. Cryptococcus neoformans is pigmented kind of culture media. If it is other Cryptococcus, then it would be non-pigmented, Cryptococcus lawrenci. And what else did we discuss? Can you please tell me about the Leptospira question you had? What was the Leptospira question? Anybody, please help me. Can anybody help me with Leptospira question? See, let me tell you what are the points about Leptospira that have been asked in the past. You tell me which one had come in the exam. Did they ask you about question mark sign? Did they speak about, they look like a question mark shaped organism. That is why it is called as Leptospira interrogans. This was in 2018. And it was about rat, rainfall, and rice fields. Was it about that? Was it about Weil's disease? Was it about meningismus? Was it about the organism being a spirochete? Was it about, I'm telling you all the possible questions in the last 4 years. Was it about the Korthoff's medium? Or was it about Ellingshausen, McCullough, Johnson, Harris medium? Fever, jaundice, travel history. Triad of Leptospira was given, renal involvement, conjunctival involvement. Excellent. So Leptospira can cause conjunctival suffusion. It can cause conjunctival suffusion. It can actually attack the liver first. Remember, this is the only bacteria capable of causing hepatitis. Other bacteria like gonococcus and chlamydia can cause perihepatitis, which is Fitz-Hugh-Curtis syndrome. But Leptospira can directly attack your hepatocytes. It can cause hepatitis. So liver enlargement can be seen. Because, now let me tell you the things faster. If you are interested, listen to this. When liver fails, it fails in two ways. Blood is not able to pass, so you have portal hypertension. So that back pressure happens, varicosities can happen. And varicosities can bleed into the stomach. If at all the pressure increases through the esophageogastric varices, the bleeding can happen into the stomach. Now the liver fails, albumin synthesis also fails. At the same time, coagulation factors 2, 7, 9, 10 are not produced. So bleeding continues. At the same time, the Leptospira can cause thrombocytopenia. Now all these things can make sure blood supply can slowly start dripping. When the BP starts falling, the glomerular filtration rate falls because the renal blood flow also falls. When the renal blood flow falls, initially it will be pre-renal failure, which can only cause, pre-renal failure can only cause the urea levels to be elevated. Slowly it can turn into renal failure where both urea and creatinine can be elevated. This is referred to as hepatorenal syndrome. So was it about this? Okay. Bacteria, fungi, both are limited to the skin. Hepatogenous spread, what's wrong? I'm not very sure. So Calf tenderness, no oliguria. Okay. So no oliguria means the kidney has not been involved. Okay, no translation history. Okay, no travel history. Done. So just remember, if it was conjunctival suffusion, liver is enlarged, and if there is any sign of all these things, they can be leptospirosis, Ellingshausen, Meckellar, Johnson, Harris, Kortoff's medium, rat, rainfall, rice field, Wheels disease, question mark sign. These are the most common things raised in the past 5 years. I hope you would have answered all these questions. Okay, so I have revised as many questions as possible. Now I can tell you only one thing, people. Remember, you have done your best. Whatever you have done your best. Either you are a repeater from the previous years or you are a fresher. Remember, you can't keep being very rude to you or very hard to you. Please don't be very hard on yourself. You have given your exam. The next exam will happen after 6 months. If at all you're choosing to have INICT, it will happen after 6 months. If at all you're focusing on next 2023, or if there is a NEET 2023, we are not very sure about it. Just relax for the next 5 days. At least you can be very kind to yourself to be in 5 days. So take care of your health very properly. Sleep tonight. If there are any other revision sessions or recall sessions, just get to them. If you have a proper idea how many are right and wrong, you will know how to do it. Deal with that for the 1 to 2 days and then relax for 5 days. No matter what you do, you will not be able to change the question paper now. All this discussion is only meant to make sure you're having a better life, or in the future you'll be able to answer better, or you know exactly where you stand. That's all. And I wish all of you all the very best in your results. I really wish you will be able to get the seat of your choice. From the bottom of my heart, I am actually praying for you. If at all you've been my student, I have to be responsible for you. If you win, it's my victory. If you fail, it's my failure. So I really want you to win. From the bottom of my heart, I pray for your success. All the very best, please. And if you like the session, please put a thumbs up so that it can actually be seen by others. Many people can learn from this. If there are any extra added points or any other questions you have to actually add or any options, please put them in the comment box section. Please share it if you like it. Thank you very much. Good night. Wait a minute. What was the question? Okay. Wait a minute. See, if you say chromogenic agar, this can be helpful for differentiating. Chromogenic agar can help in the differentiation of Candida species. Candida species and identification. Identification of Candida species. See, this was the problem. Some students told me how to identify. For identification in case of Candida, that is, if you want to know what is the organism, then you go for SDA. But if you want to differentiate between the species, then go for chromogenic agar. Is that clear? Yes? Okay, have I answered your question? Some chromogenic agar can help in the differentiation of Candida species, but generally you go for SDA agar, okay? If you want to identify the Candida, it can go for SDA. If you want to differentiate between the species, then it may help. But if you just want to know whether it is Candida or not, then you can go for SDA. Have I answered your questions? See, chrome agar has been helpful for differentiating between colonic bacteria. But at the same time, if you want to differentiate between species of Candida, then you can go for chrome agar. But just if at all there is an organism, you want to grow the organism in Candida. See, look at this. If it is just a Candida, you want to grow it. I am not pretty sure about the question. If you want to differentiate between the bacteria, then differentiate between the Candida, then you can go for chromogenic agar. Okay. No problem. Let me finish it off here. See, chrome agar has always been helpful for differentiating species. Differentiating species. It can be in case of colonic bacteria or coliform bacteria. It has been helpful in case of Candida species also. But if you want to identify the presence of Candida, then you can go for SDA. Okay, identify the presence of Candida, you can go for SDA. With this, I'll try to conclude the statement. I repeat once again, chrome agar, differentiation of species in both Candida and colonic bacteria, but can be for SDA also. Is that clear? Yes, 1 minute. This is a new chromogenic medium that has come up. You also call them as Candida ID agar. See, tell me whether it was differentiation of Candida species or it was just identification of Candida. Was it identification of Candida species or just looking for Candida? Okay, so now let me tell you one thing. There is a new chromogenic agar that will be containing this chromogenic agar will be containing different species of Candida, right? It can contain 10 gram of mycological peptone, but this is also based on SDA, and this is 10 gram of mycological peptone, 15 gram of agar, and you have a new chromogenic content called as chromogenic glucosaminidase substrate ammonium. Glucosaminidase substrate ammonium, and it is a very complex molecule. The glucosaminidase substrate in CDA was hydrolyzed by Candida albicans and dubliensis. It can yield white colonies with deep red spots. Okay, deep red spots on a yellow transparent background. I repeat once again, the glucosaminidase substrate is broken down by Candida albicans, chromogenic agar, Candida albicans, and also for Candida dubliensis. It was able to produce deep red spots. Okay, all the very best, people. So let me take your leave. If there are any other options that I didn't understand properly, please put them in the comment box section. It can be helpful for me to produce a lot. See, differentiation of species, you can think of chrome. Identification, just to see whether the organism is present or not, SDA. But some of the chromogenic agars are based on SDA. Okay, so with this we'll conclude. It can be a long discussion also, but let me conclude now. Thank you. Bye bye.